My name is Dr Stephen Pillinger. I'm a colorectal surgeon at the Sydney Adventist Hospital. Well, robotics is a very exciting area of modern surgery and really represents the latest evolution in minimally invasive surgery, or what most people would know now as keyhole surgery. The essential differences with robotic surgery are that the robot is not a true robot. It can't do anything autonomously. A human is always in control, but the bad side of human control is sort of largely taken out of the equation. The robot holds the camera for us, it holds all of the instruments, and gives us a degree of control that we haven't had before. What it also does is give us absolute clarity of view, in that it's a true 3D 10-fold magnification view of any operative field. The control of the instruments is very precise. All those things that are human foibles, like not enough sleep, too much coffee, distractions from life, are taken out of the equation because the robot will just do whatever it's told to do and filter out all those unwanted movements and distractions that you've got in normal operating conditions. Well, the real benefit of this type of surgery is that not only do you have the benefits we've just spoken about, but you always have someone at the patient's side. As I said, it's not a true robot in that you can't set it up, connect it up, and then go and have a cup of tea or check your emails. There's always a human in control. So the way it works is the patient will have normal small incisions made as per normal keyhole or laparoscopic type surgery. The ports are introduced, and then those ports are connected to the robotic arms. The instruments are then introduced along with the camera, and those instruments and camera are then controlled from a surgeon console in the operating theatre. So there's two components to it. There's the surgeon console, and then there's the patient cart, which actually holds the instruments and camera. Well, what is exciting about this next generation XI robot that we have is that it is far more versatile than previous generations of robotics or minimally invasive surgery, in that we can have a lot more freedom of access. We can use a camera in whatever port we like. Typically there's 4 ports. In the previous generations of robots, there was only 1 camera port, so once you'd made the decision where the camera was going to go, that was it. Now we can what we call port hop, as in place the camera in any of those ports and use any instrument in any port, so that the range of movement and access is unprecedented to what we've had before. And even with laparoscopic surgery, handheld cameras and instruments, you don't have that degree of freedom unless you're introducing larger ports around the abdomen. So the degrees of freedom that we have and the instruments that we can use, the range is very extensive. All of the instruments that we have available in open surgery and laparoscopic surgery are becoming more and more available in robotics. For example, all the energy instruments that you hear about, diathermy is the most common one that people have heard of, but there are a number of energy instruments out there for dissecting tissue. A lot of those are now available robotically. Stapling technology is now readily available in robotics, and in fact far more dexterous than the instruments we have available with open or laparoscopic surgery. So the range of possibilities of what we can do is enormous now.